Thank you, Chairman. Every once in a while, you get lucky and can jump the queue. Um, I just wanted to pass along to the panelists the success that Rhode Island has had with these waivers during the COVID pandemic. We have made very good use of the Hospitals Without Walls program, and I'd love to see that continued. We kind of broke the back of opposition to telehealth generally, and I don't think there's really any going back on that. It's been particularly welcome in the behavioral health, mental health, addiction area, where practitioners report to me not only better compliance with showing up and participating, but also better substantive content. It's hard for them to quantify that, but it's a repeated theme that there's something about being able to talk from your own home, from a comfortable place, rather than having to drive across town and fill out the clipboard and sit in somebody else's office. It just seems better. And the medication-assisted treatment element and allowing access to buprenorphine, for instance, with telehealth has been a godsend for that population. And the last thing I'll mention is that I've been working for a long time to try to get CMMI to sign off on a bunch of waivers to deal with people who are nearing the end of life, for whom a lot of waivers make a lot of sense. It doesn't make any sense to fuss too much about how homebound somebody is at that stage of their life. Home health services waivers that we've seen through COVID are very helpful. Respite care isn't respite if you got a stuffed granny in the hospital and not get help to come to her in the house. And the whole 3-day, 2-night rule is ridiculous for those patients. And those waivers, I hope we can extend. I'd ask Director Farb, with respect to the homebound and home health service and 3-day, 2-night waivers, has GAO seen any evidence of heightened utilization as a result, heightened cost?
Senator Whitehouse, no, we have not examined that directly. We also tried to look to see what CMS has been reporting in there. So far, they've created an accomplishment report sort of describing effects of many of the waivers. They haven't included anything thus far in their reporting, but it's something we're going to be tracking going forward as we start to work on the additional waiver kind of study that we're planning to do.
Good. It's particularly important to me for people nearing the end of their lives because it just doesn't make any sense. It's kind of cruel to the family to deny them those supports because of some funding requirement that is not even designed for that population, but has these terrible effects on families and their access to care. Dr. DeCherry, are you familiar with the Hospitals Without Walls program, and would you like to comment on the wisdom of extending that?
Yeah, I mean, specifically the hospital at home portion of that is what we made use of during this pandemic. I want to also go back to one thing that you mentioned earlier about the comfort of someone in their home. You mentioned in the context of behavioral health, but I would broaden that. When we are in the home, and that could be either in person for our hospital home, the nurses in person in the home, or through the video when a provider might be doing a video visit. Seeing someone in their own context to see what they're actually eating might actually help long-term make real impacts in their lives. And so these little snippets of getting into someone's home have really improved health for people long-term. And so I just want to make sure that was understood for the possible.
Let me close out with a little brag on Rhode Island ACOs. We have two, Rhode Island Primary Care Physicians, which operates an Integra ACO, and Coastal Medical in Rhode Island, and both of them are absolutely top performing ACOs nationally. I mean, they're right up in the upper corner of savings and quality of outcome and patient satisfaction. And part of what they have done is to engage with patients in their home.
Exactly.
In order to get better information. And that is part of what has made it work so well. I will go as far as you want to go, Dr. Sherry, on this. My problem is I've been jammed up in CMMI for 10 years trying to get it just for end-of-life patients. So that's our beachhead, but I do think a lot more can be done, and the ACOs have shown a lot of good results on that. So I'll yield back because I think I'm probably out of time, but I really appreciate this conversation. There's a lot to be done, and if people at CMMI are listening, I think we gave them these powers for a reason. Let's use them.
Well said. Senator Brown.